Hey guys, before we get started on this video, guys, don't forget to subscribe to my YouTube, Dr. Jeneby Plastic Surgery, for weekly giveaways. Hit the like, subscribe, and hit the notification bell. Hey guys, we are here tonight talking about awesome things again. And I'm sorry I haven't been on in a couple weeks, but I think I got a little busy with some other things, and I hated not being on, and Twitter's not working, by the way. Okay. So today we're going to talk about plastic surgery, weight loss before, what to eat after, how to exercise before, what can you exercise after, for everything that we do just about. So a little bit about my background. I was a Penn-trained plastic surgeon, and at UPenn, they invented what they call TPN, which is IV nutrition. Janet, how you doing? She waved at us. So did Anna. Jessica Zamora, our wonderful, awesome finance manager, is watching. Santa Hernandez says, hello from San Antonio. How you doing? Dr. Eric Williams is watching, and I'm trying to wave as many people as I can. I guess you guys missed me a bit. So nutrition. What is nutrition? What is surgical nutrition? Maybe you can see what's going on with this crazy Twitter right here. Here you go. I'm going to make Joe John take care of business here. So, what's up? Okay. Juan Hasso says hello. So, try that one. So anyway, sorry, we've got some technical difficulties. So nutrition. Why is, hello Juan Hasso. So why is nutrition super important? Oh, Jeanette 1 asked me if I'm doing a boob job giveaway. And did you win? No, that's just kidding. We're not giving any boobs away. You cannot give boobs away as a plastic surgeon. It is not legal. But we wish we could sometimes. So, nutrition. Before surgery, you should be properly hydrated. You need to be on nutritional protocols. In our office, we put you on what they call Vitamedica, which has thousands of percentage of B6, B12, and all the good nutrients you need in one vitamin that starts 7 to 14 days before and lasts 7 to 14 days after. Isvela Harmon says, well, hello, Dr. J. How you doing? So we put you on that. And after we put you on that, we also add in some protein. Why is protein so important? Well, protein is the backbone of all collagen. Yes?
It just flipped over to me.
What?
The camera randomly.
No, it's fine. It's back. So protein's super promising. So what I do is I put you on protein. So I put you on about 90 grams a day for 5 to 7 days before, and then you finish out the protein shake all the way after. What we have found, and what we have found surgically about all this, is that protein, people who are on their nutrition and protein tend to do better after surgery. Big surprise. They've known about that for a while. And I don't care what kind of diet you're on, it's especially not good enough diet to heal after surgery. It may be good to lose weight or to do some of the things you want to do pre-op and post-op. Non-pre-op and post-op. But once you have, we're going to stick on our Twitter peeps and get them involved. Oh, it says mute. Sorry, since we're on our own production team. So once you have good diet, for example, you have the Vitamedica, then you have the protein shake. We had a probiotic because, as you know, once you take antibiotics, you're going to wipe out your intestinal flora, and it's going to be a mess. So we put you on a probiotic. We also like to have you take arnica before and after surgery with bromelain. Arnica is for bruising or swelling, and bromelain is for bruising. And why is bromelain good for bruising? It has papain in it. And papain is from pineapples. So it tends to reduce the amount of bruising that you have. And I think I got that mixed up. The bromelain actually has a papain for swelling, and the arnica is for bruising. Excuse me, sorry, made a mistake, but we make you take both. So pre-op, you're going to have to get into a good nutritional form. And when you get into good nutritional form, you'll know it. Sorry, I've just got to turn up Twitter. Nutrition is not obvious in people, and people think that if you weigh a certain amount, you're going to have proper nutrition. Well, that's not true because when you have, even though if you think you're overweight and you think you have enough because you're a larger person, that doesn't mean you have enough nutrition for post-op at all. That just means that you're taking the wrong kind of nutrition. So for about 5 to 7 days before, we're going to get you on a nutrition plan. We're going to start you on vitamins, arnica and bromelain, and we're going to start you on protein shakes. And we're going to continue the vitamins and protein shakes up to 2 weeks after. If you are in the health field, you're a nurse, occupational therapist, physical therapist, MD, NP, PA, anything that has to do with medicine, when you're going to be touching someone, your incidence of MRSA infection is very high. And you're just around antibiotics. So we put everybody in the medical field, because this has happened to me, where somebody didn't tell me that they had MRSA, that we put them all on Bactrim, which is a Bactrim Septra. And we start that 5 days before and 2 weeks after, according to the literature. And we start them on HibaCleanse washes. So once I hear medical field, once I hear that, you're automatically enrolled in our medical program. We also put Bactroban. We also write a prescription for Bactroban, and it's an ointment you put in your nose. So there's 3 things, and it's up to you to really do it. So just do it. And, listen to the doctor sometimes. So finishing up nutrition, if you're hyper exercising, that's great because that makes you use less narcotic afterwards, as your body is used to pain, and it's used to having endorphins to be moving and grooving when you're into pain. Well, when you're exercising, you need preoperatively more vitamins and minerals as you sweat those out, and you need to be more hydrated. So starting 3 to 5 days before, we like to see you on some type of a Powerade, a sugar-free Powerade, a G2, several bottles a day to hydrate. Because afterwards, we notice that people who are extensive exercisers tend to have issues post-op with having a little dizziness sometimes, because they haven't lost a lot of blood. It's just they came in underfilled. So again, hydration is on the continuum with food. So you have food and vitamins, protein, and then antibiotic prophylaxis and hydration. So there's so many things we get you ready with. And I just really believe in this. I've been around plastic surgery now on my own for now 18 years, close to 18 years. And add another 6 years on to that for residency. That's almost 24 years. And the people that do the best are well hydrated, do not smoke, their diabetes is under control or they have none, and they have proper nutrition. So again, moving along this continuum, protein shakes, 90 grams a day pre-op and 90 grams a day post-op until you finish your protein shake. Pre-op about 5 days.
What precautions, I'm going to ask you, the massage therapist?
Yes.
What precautions do you take as far as medication for that?
I don't understand. Medications for what?
You talked about like the nurses, like them.
Oh, so if you're in the medical field, we give you a HibaCleanse wash. HibaCleanse is a little blue bottle. You put it in your shampoo and your body wash. You're going to wash your hair and your body starting 5 days before. And here's something interesting. You also put it in the shampoo and body wash of your significant other that's going to take care of you. Because you bringing home MRSA means your whole house is full of it. Your bathtub, your couches, anything that you have touched. It could be MRSA, E. coli, anything. If you're in the medical field, forget it. You are colonized.
She's a massage therapist.
Yeah, but if she touches patients or nurses or other doctors, pretty much it's ubiquitous. So put Hibiclens in your shampoo and your body wash. You and your significant other. And you start washing with that 5 days before, and then the patient will wash again the morning of, and then everybody else washes again for 14 days after. We also tell you to put a little Bactroban ointment, which is a prescription, inside your nose as you carry these bugs inside your nose. Then the protein shake, we already talked about the vitamins from Vitamedica, which can only be purchased at your doctor's office. And what it is, it's super concentrated vitamins. It's got thousands of percentage of all the B complexes, the C's, and everything for wound healing, and zinc. It has tons of other vitamins, and we like it also because it does not have fish oil or aspirin or vitamin E, which can all make you bleed. That's why I don't like regular vitamins, because it has all three of those. So use our vitamins for the first 7 days before and 14 days after, and then go back to your vitamins when I clear you. So that's pre-op. Everybody get that pre-op. Vitamins, Hibiclens washes, if you're in the, to everyone, but especially medical field. Bactroban in the nose for medical field. Hydration if you're working out a lot, and that goes with everybody. And also reduce your alcohol level a little, because you're going to become dehydrated. And when you're dehydrated, you just don't feel as well. So reduce alcohol activity, hopefully down to 0 a week before surgery. You can live without alcohol for a week. I know you can, because it's not an important function of the body, nor is it necessary. Take your protein shakes, 90 grams a day. We have really great tasting protein. We're a distributor of a protein product that we like, because it has awesome tasting protein like cake pop, and it has like cheesecake, and it has muffins, and it has all this great stuff. So you're going to be taking all that. So before you even get started with us, we've already started to take care of you and your nutrition. The hardest people I take care of are vegans. Vegans universally have a hard time just completely healing the first time. So, and that's true because you need more protein in your diet. So if you're not getting enough protein in your diet, you're not going to build bridges of branched chain amino acids and close the wound. So just letting you know. Question on YouTube. What is the brand of protein shake? Oh, I have to get back to you on that. The office knows, but it's a great brand. You can call the office tomorrow. I'm so sorry. It just slipped my mind. I should know this by heart, but it slipped my mind. Sorry about that. But it is a great protein shake, and we have it. We have a lot of people waving at us on Instagram, so I'm waving back to you guguys. Jeanette77HDZ wants to be in your live video. Sorry, Jeanette, one person at a time. Patsy Ibanez says hello. So now we've got nutrition covered. Okay, so nutrition is done pre-op. Post-op nutrition, just as important, because the first few days, you're going to be drinking less and eating less. So I need you back on the protein shakes, and I need 90 grams a day minimum for the next 14 days to 21 days. We need you on that Hibit. So there's the protein shakes. We need you hydrated. Sugar-free there it is. PE Science Select Protein. Did you put that in, Ashley? Okay, there it is. For you YouTube, it's called PE Science Select Protein. That was Twitter for the Twitter fans. Okay. So the hydration is right there as well. The Hibiclens washes continue. If you're in the medical field, Hibiclens with Bactrim with nasal swab. That continues on. Again, no smoking. For those of you who smoke, if you've ever been to my office, we're huge against smoking, because smoking reduces the body's ability to heal a wound. It's proven, it's in the literature, includes weed and marijuana, includes vaping, everything. So, that's basically it. So, along with that, Then you post-op, you're going to make sure that you continue on with your normal diet, but add the protein diet, the PE Science Select Protein. We're going to put up our specials. I'm going to pause real quick. Our specials of the month for surgery is a mommy makeover, a beautiful mommy makeover for $13,999. That includes a breast augmentation and a tummy tuck with 5 areas of lipo. The standard areas are the flanks, the upper back, and the mons. I automatically do the upper abdomen, but those are the 5 areas. It is a great deal. You're saving about $3,000, and here's the rub. Just text us your name, email, and phone number. We're going to put up all of it to 210-270-8595 and mention you saw me here for tonight and book in October or November. We only have 1 or 2 slots left in October, not many, if any, but definitely we have several spots in November, and you'll get $500 off a surgery. It's a great deal. You're not going to find it anywhere else like that in my office because I'm live with you right now. Also, we're doing a lot of specials on our spa. The spa is, I believe, 3 chemical peels for $199 total, just for the month of October. We're also adding in a radius filler plus 20 units of Jeuveau for $899. That's basically the price of the filler and almost throwing in the Jeuveau or the Botox. And the last one, remind me that one. What's the last one for spa? My line?
20 units of Xeomin and a syringe.
I did that one. What's another one? Chemical peel?
3 images.
I did that one. Now the last one.
Buy 1 area of laser hair removal.
Okay. Buy 1 area of laser hair removal and get the same area complimentary. So awesome, awesome, awesome. Be sure to text in your name, email, and phone number and what you're desiring and have surgery in October or November. I think maybe 1 slot left in October.
Alma said, see you in November.
So Alma, nice. So Alma, be sure you text us to 210-270-8595 ahorita, right now, so that we can get your all your stuff, and then Jessica will be texting you back tonight. I got something from my niece. Hi, Uncle Type. You're doing awesome. I'm so proud of you. Thank you, Kenzie. If you don't know me, I have a great niece named Kenzie, and she did the first official intro to these with me. So she's awesome, and she's on my sister's Facebook account because she's not allowed to have one. She's only 10. So she's watching tonight. She did the first one with me. Hi, Kenzie.
What about consults?
Consults.
Where are you doing consults tonight?
Oh, tonight we are going to do some virtual consults. We can do them through the website, or you can type in doxy.me/Dr. Jeneby Consult. We're going to put that up for you on all 3 platforms, so you guys can cut and paste and put it right into your header, right into the box at the top of your website. Alma Elisa Salceda says, I already have an appointment booked in November for consult. Nice. Again, I'll be doing the consults. I'll either be doing it by computer or by my cell phone, because I can do the consult all on cell phone, and so can you. If you get confused, just go to the website, drjenevybplasticsurgery.com. Go click the hamburger button at the top. It's a drop-down menu, and see virtual consults, and go right into the waiting room, and we will get there as soon as we can tonight. And I can do the entire consult on the phone with you. It's private, and it's HIPAA secure. So after surgery, let's get back to what we're going to eat. After surgery, it's eat what you normally eat, but add your protein, make sure that you're well hydrated, and we're going to add some vitamins. Protein, hydration, and vitamins. That is the cornerstone of how you're going to get better. We also like you to get the arnica and bromelain, and we like you to get the probiotic. The probiotic is really good because your gut is going to just get flattened, and the good bacteria is going to be removed, and possibly you're going to have issues in your private areas when you're on antibiotics. So the probiotic is very good for that. Again, we put up on all of them, maybe on Instagram, we can put up virtual consults. If you can put that up.
Put it up.
Yeah, put it up. We'll put up right now on virtual consults. How you can get into it. Again, I'm going to use my phone and just do consults on the phone through my doxy.me platform. And that you can find on my website under virtual consults. So after you've done the protein, you've done the hydration, you've done the vitamins, the probiotics, the arnica and the bromelain, which all comes as a pack from us, by the way. You're going to be making sure that nutrition is not the reason that you have any issues after surgery. You have to follow exactly what we tell you, though. You can't improvise. You have to just listen to us. And that's hard for people to do sometimes. My goodness. But you got to listen to your doctor. So exercise. We'll move on to exercise. So exercise before surgery. Everybody says, well, how much weight should I lose before I have surgery with you? For example, mommy makeover. So that's really variable because there's some people I do what they call a paniculectomy on just to get them able to exercise because they have such a large apron of skin that they get fungal infections under that apron and they just cannot exercise. It's very difficult to find any clothes. It's very difficult for them to get into the mood of exercising. So when I remove that pannus or extra skin, it motivates quite a bit of people, I found, in the last 18 years to get moving. And people are so happy after you remove that apron of skin. Now, how close do you really have to be for a successful tummy tuck? I'm not talking paniculectomy, large tummy tuck. I'm talking about standard tummy tuck with a BMI between 32 and 34 or under 34. You should be between 30 to 50 pounds of your goal weight. So let's do the math. Let's say you're at 245. 30 pounds of your goal weight would put you at 215. I'd like to see you below 215, maybe in the 180 mark. So 30 to 50 pounds. I really don't like 50 pounds. I like more 30. You have less issues of surgery. You have less complications of anesthesia. So between 30 and 50 pounds, more on the 30-pound side. I've seen people who are 50 pounds over who are healthier than some people who are under 30. So again, I do all the medical clearances and I check on your charts and I read all the labs. So I'm making sure that you're healthy enough for surgery. I personally do that. So again, if that's what we got to do, and you have to get between about 30 to 50 pounds. Now, liposuction is not a weight loss procedure. Every 2 liters of liposuction I do is roughly 4.4 pounds. So I can do up to 6 liters safely in Texas as an outpatient. That's only taking off 12 pounds. And honestly, your contour looks better than actually the weight loss. So try to get to your absolute within 30 to 40 pounds of your goal weight, your personal goal weight, to get lipo or a tummy tuck. Lipo does not lose any, it loses barely any weight. If you're talking 12 pounds and you're in the 200-pound range, that isn't very much. So remember, exercising before surgery is very important. It does 2 things. It gets your heart and lungs ready for surgery because those kind of things make the anesthesiologist's job super easy. It's not 100% easy, but they love it when they are working on athletically inclined people. Should you not be athletically inclined, at least start walking a month or so before surgery. Get your heart rate up because basically you're practicing for being in surgery when your heart rate does go up. And we want to make sure that you're healthy enough. So exercising before your surgery is super, super important. It gets you so that you reduces your narcotic needs and increases your exercise tolerance and reduces your need for drugs intra-op and makes it easy for you post-op because you don't need a lot of narcotics post-op as well. So get as healthy as you can pre-op and post-op. So exercising is key. Now, what happens after surgery? Now, you're going to get surgery. If you are a facelift candidate, just the face, right around 1 week, I release you to do most things non-strenuously. So if you've been doing CrossFit, very, very light CrossFit, because you don't want to get bleeding into your face, neck, jowls, or even forehead for brow lifts. It just leaves you very unhappy. You get bruising. So if you're just doing face work, somewhere around 1 to 2 weeks, you can get back into exercise. Let's say you're doing just lipo of the body. I pretty much tell you to go back to exercise when you feel like it. Most people feel like it after 1 week to 10 days. Into a mild program, then moderate, then heavy. And you can move pretty fast just from lipo. Breasts. Well, obviously, when you have breast implants, you're not going to be able to do any chest exercise. So anything with pull-ups, push-ups, or anything with flies, you can't do. I always tell my breast dog patients, wait a big good 4 weeks before you get back to doing serious stuff, because you can really kind of screw up things. You can cause bleeding, you can cause weird contractures of your breast, you can cause scarring. So wait a little bit of time before you do that. So on breast dogs, 1 week I let you carry kettlebells on the side of your arms. I let you carry that on the side of your arms and walk. And lots of walking, then more walking, then more walking. What if you get a tummy tuck? What can you do after that? Again, it's sort of like a breast dog, except you're adding now, you're adding stuff you can't do with your abdominal muscles. So push-ups, sit-ups, not good for people after tummy tucks. It's mostly a lot of walking for the first 3 weeks with some faster walking after the second week, with faster walking after the third week. Instagram. Do y'all have anything to enhance the butt without surgery and injections? No. Sorry, it's either surgery, it's either a BBL or a butt implant, or injections, either fat. You can do injections with stuff like Radius and things like that. Gilbert Marsha Barrienta says tummy tuck with 360 lipo with question mark. I'm not sure what she's asking. If it's a price, it's probably in the $12,000 to $13,000 range. Gilbert Marsha Barrienta says and lipo the arms. Again, every time you add something, you're adding about $1,500 to $3,000 per for both sides. So you're looking tummy tuck with lipo 360, with lipo in the arms 15,000 and 13 to 15,000 and above. Don't really know the actual cost till we see you, but that's a basic, and we do in-house financing. Sorry, we don't have anything to enhance the butt without surgery injections. They're trying to come up with ways to make your butt muscles work better, but if you don't keep up with it, if you don't keep stimulating the butt muscles, then it's going to go back down. So really, surgery is the only way right now. There's nothing crazy. But we do have in-house financing, Ms. Barrientes. So again, exercise after. Let's say you get your arms done. Well, obviously, it's going to be very hard for you to exercise. So when you're exercising your arms, remember, everything you do is with your arms. And I always quote people a 90 to 100% chance that if they don't follow directions, they're going to have an opening on their arms. And they're usually not severe. They're usually small. But it does give people some peace that I've told them ahead of time, and they understand. So when they come in, they have a small opening, they put some creams on it for 1 to 3 weeks, and it closes back up. The most I've seen them open is 4 to 6 weeks. So be careful with your arms when you're having surgery. What time is it right now?
7:59.
Oh, okay. What else? Let's see. Your butt. Okay, let's say you have butt surgery. So you have either a BBL or you have a butt implant. Butt implant takes about 4 to 6 weeks for you to get back into the groove. A BBL with lipo, for example, you can get back into exercising somewhere around 2 weeks, very light. In both BBL and butt implants, there is no sitting on the buttocks for 2 weeks. So do not sit on your butt for 2 weeks. So when you don't, so we don't crush the graft and we don't put pressure on the implant. So you will not be able to do everything you want to do with a butt implant and with a breast implant and a tummy tuck. Those are the very hard ones for you to do it after activity after. I do have options for you guys. I mean, I can always send you to personal fitness and personal dietitians after surgery. So if you want that, you definitely ask. Tonight, again, I'm going to go over our special. Tonight's special, once you text in 210-270-8595, you will take advantage of our October special of a $13,999 mommy makeover, which includes a breast implant and tummy tuck. And if you text in all your information tonight and mention this and mention the special, you can get $500 off surgery if you have surgery in November. We have 1 or 2 slots left in October, but we're pretty much booked out. What else?
Spa Black.
Spa Black, don't forget the specials are 3 chemical peels for $199, buy 1 area laser hair removal, and get 1 of similar value complimentary. And then the last one is buy 1 Radius, which is cheek filler and nasolabial fold filler, and get 20 units of Juvo complimentary. That's it really. I hope you like it. So preoperative, we focus a lot on protein shakes, vitamins, hydration, HibaCleanse washes. If you're in the medical field, we add Bactrim, HibaCleanse, and intranasal Bactroban. Also, tell us if you've ever had surgery before and had a problem with your surgery, such as an infection that never healed. You're probably a character. Probably a carrier, not a character, excuse me. Post-op, similar. Post-op in that we're going to continue the protein shake, the hydration, the HibaCleanse washes, the Bactroban in the nose, and continue on with your diet. A lot of you won't be able to eat after surgery what you want because you're still nauseated and you're still kind of going through things. So we hope that that you just follow exactly our direction. I've been doing this a long time. We're not spring chickens at this anymore. I've been doing it now 18 years and just loving it. Just loving being able to give advice. We'll be signing off here in a minute. If you have any questions, please ask them now. Otherwise, don't forget to follow my YouTube, Dr. Jeneby Plastic Surgery, and my producer here, Joe John, with Nines Video Marketing, who's been faithfully with me for the last 5 months, is going to pick a winner every week that is a new subscriber. And we'll be giving away something. Yeah, he's going to put the link to my YouTube, Dr. Jeneby Plastic Surgery from YouTube. Everybody go on and please subscribe and then hit the notification bell. Not only because you're going to get a cool prize every week, and we'll just pick one every week, but you also get to see all these videos, all the surgery videos, any videos we make for Spa Black, and most of our specials go up on our YouTube as well. So incredible. I really enjoyed being with you guys today. I know that the Democratic debate was on, but there's no debating this. You got some good advice tonight, and now go back to your lovely families. Thank you for watching. This will be replayed on Facebook again, so you can see the whole recap, which is basically exercise and diet before and after surgery. So I really appreciate you guys. God bless. Have a great night. Hey, thanks for tuning in tonight for what to eat and what to do exercise before and after surgery. But next week, it's about the lips. Lip fillers. We're going to talk about what to do, what not to do, how to keep yourself out of craziness. All about the lips next week. Come on.